I'm Jorge Miranda. I'm a vascular surgeon at Baylor Medicine. Here at Baylor Medicine, we have the STEP program for limb salvage, and it really is a unique program for the patients because, number one, it offers a multidisciplinary approach to the treatment of limb salvage, meaning it's not only me as a vascular surgeon, we have medicine specialists to treat the diabetes and to treat other medical conditions. We have a podiatry team to treat the wounds specifically, meaning offloading the foot or aiding in healing of the wound itself. And then we offer rehab and prosthetics to be able to get the patient to a functional standpoint. As far as repairs, we have minimally invasive options such as endovascular reconstructions and recanalizations, and we have clinical trials with technology that are not offered elsewhere. As far as open options, we have venous arterialization and distal tibial bypasses with excellent results for our patients.